You're going to see something that is absolutely a national fucking disgrace.
I just survived two heart attacks, open heart surgery, and 3 weeks of life support. I was in the hospital for 9 weeks. I'm a Marine Corps veteran, law enforcement, and I just received a $500,000 bill. Oh, don't worry, I got more. Got another one, $22,000. Just to let you know, this is a fraction of the percentage of actually everything I have. It's over $2 million.
There's three things wrong here, and I'll try to keep this short, so let's get into it. Number one, if he had Medicaid, he wouldn't have to worry about any of this, and that's just not right. Now, I'm not talking about people who legitimately need it, but it's crazy that there's lazy slobs that can pop out however many kids and then game the system and stay on Medicaid and welfare for eternity. All their health care, their food, their rent, and whatever else these little princesses need is going to be paid in full by the government. And it's not right when the people who protect us, who defend our nation and freedom, are treated worse than some lazy pig gaming the system. They should all just go fuck off back to the fresh hell they came from, and then maybe we'd have enough money for these soldiers. Number two, Obamacare only benefited the health insurance racket. And make no mistake, it's a racket, and it always has been. All Obama did was give the House better odds. What do you think is going to happen when you force people to buy a certain product? Well, the price of that product goes up and the quality goes down. And since Obamacare, premiums have risen and what health insurance covers has gone down. His bullshit healthcare act destroyed quality healthcare at entry level prices for the middle class. Number three, healthcare costs are outrageous. And yes, the healthcare systems are partially to blame for that. However, they aren't the great Satan people make them out to be. Reimbursement for Medicaid claims can be as low as 58 cents on the dollar. Unfortunately, that cost difference gets passed down to the privately insured. Also, if an illegal alien doesn't get Medicaid for whatever reason, and we know most of them do, they also know how to abuse the system. That's one of the reasons why you have to wait an eternity at the ER. They know hospitals can't turn away patients in the emergency room, so they flood that system. Well, then they ghost that system, and the hospital ends up not getting paid. The shit with these illegal aliens trickles down to all of us eventually. And lastly, insurance knows that they don't have to pay and can push it off on the patient. Most patients can't afford these high deductibles, so they don't pay. Or they'll settle for pennies on the dollar. Or they'll just pay the bare minimum for the rest of their lives. Because of that, most hospitals are operating in a deficit. So I get it. At first glance, blame the hospitals for these outrageous bills. However, we got to look at why the bills are so high. And above all, we need to take care of these vets. There's no reason why a vet should have to pay a bill like this while worthless welfare recipients and illegals get it for free. And the insurance CEOs, they live like fat cats. There's no reason at all this should be happening, especially to our vets. Now, what can be done about it? Well, one, stop handing out disability to anyone that fights Social Security long enough to get it. Look, you don't need to be disabled if you have depression or some other bullshit diagnosis. Disability, which makes them eligible for Medicare and Medicaid, should be reserved for the population that cannot work at all because of a crippling disability. Also, welfare to work. Too many in our population have decided that welfare is a lifestyle, not a short term benefit to get them over a temporary hump. They live off our dime, and as you can see in this video, their freebies get passed down to all of us. Another option is end Obamacare. It does nothing but help the insurance companies. It doesn't help any of us, just the CEOs, and they need very little help. Also, we need to get illegal aliens out of here that drain the system. This soldier is a direct result of financial drains on the healthcare system and that cost trickling down to us. Most doctors will not see you if you can't pay your bill. Illegals know this and treat the ER like a primary care office because they know they can say fuck off when the bill comes. And that's just a start, though. Let me know in the comments your thoughts, and then maybe we can work together to make this shit better. Hit like, hit subscribe, and follow me on social media. Till we meet again, live unrepentant.
You've got to say, I'm a human being. God damn it. My life has value.